ahead and get started. Thank you. We'll go ahead and get started here. Thank you. We are recording this session and we will be dropping it out to our various social media platforms, either with AARP and or with Land of Sky Regional Council. So we're delighted that you've joined us. I'm Maureen Williams. I'm the Director of Care Navigation with Four Seasons, the Care You Trust here in Western North Carolina. And I get the privilege of sharing with you about this program and introducing these amazing speakers to you. Before we go too far down that path today, please know that there will be a survey emailed to you for those of you who have registered, and we very much value your input. We incorporated a lot of what we learned last month into our formatting for this session. So please believe us when we say we really do listen. So thank you for that information. We will be fielding questions throughout the program, and after our speakers are through, we will make sure to do our very best to ask all of those very important questions. And believe me, Tasha and Catherine want to answer them. They really do. We all want you to have some new tools and new information as we go along. So please know you will be receiving a survey by email through your registration. So we're delighted that you've joined us. This is our third series that this group has provided. It's an nationally award-winning series on harnessing tech to connect. And today's topic is really about how to use things from the simple to the savvy to help with medication management, medication adherence. And I am just delighted that two people with whom I work in the community here in Western North Carolina are going to be sharing information with you. And these are two very wonderfully skilled pharmacists, Tasha Woodall and Catherine Gilmore, and they're going to introduce themselves. But please feel free to drop your questions in the chat as we go along, and let's see what we can learn today. So Catherine and Tasha, the time is yours, and thank you very much.
Thank you so much, Maureen.
Catherine, will you go ahead and introduce yourself?
Yeah, absolutely. So I'm Catherine Gilmore. And I'm a pharmacist with Sona Pharmacy in Asheville, North Carolina. And I've been here for about 1.5 years as a pharmacist.
My name is Tasha Woodall, and I'm a geriatric clinical pharmacist with MAHEC, which is the Mountain Area Health Education Center, and do some teaching with the UNC School of Pharmacy as well. And Catherine and I are going to kind of go back and forth a little bit. I will tell you for myself up front, kind of full disclosure, we're going to teach you about a few gadgets that I have never actually laid eyes on. I've maybe seen them, come across them online, but I haven't really had occasion to get hands-on experience with it. So I just wanted to be transparent that not all of my information is based on practical experience. Other things Catherine may have more experience with than I do, but we'll do our best to answer your questions based on what we've seen out there. And so I'll start us off, and then Catherine will talk a bit about some of the things that she actually does do in her pharmacy, Sona Pharmacy, which is an amazing pharmacy here in Asheville. I will share my screen. Catherine, are you seeing slides?
I am, yes.
Thank you. Okay, so medication adherence technology. Adherence is our kind of fancy medical term for whether people do or don't take their medications. And as we'll talk about, there are lots of reasons that someone might not take their medications, whether it's intentional or unintentional. But we want to pay attention to it because it turns out that there are a lot of consequences associated with non-adherence. And again, that sounds like something that we would blame someone for. That is not the case. It is not something that we kind of slap a diagnosis on someone as being non-adherent. We just want to try to get to the bottom of why and how we can help people stick to their medication regimen if it's the right one for them. So we pay attention to it because there's an estimate that 125,000 people actually die every year because of medication non-adherence, maybe not taking a medication that's important for them or not taking it in the way that it was intended to be taken. And those are avoidable deaths. And of course, there's a lot of cost associated with that as well, on the order of about $100 billion annually. And again, very preventable. So we know that there are a lot of reasons that someone might have trouble sticking to their medication regimen. Sometimes it relates to the person who's taking the medication, maybe because of memory, forgetfulness, or people who just feel low mood and are not as motivated to do things that are part of just the overall plan of care for them, or maybe have trouble seeing the instructions on a bottle, or have trouble opening the bottle because of dexterity issues related to arthritis, as an example. So those are some things that, again, are fixable. There are also factors related to the medications themselves, and we know multiple medications or very complex dosing regimens can contribute to that. So the more medications someone takes, the harder it is just to keep track of all of them and when they're supposed to be taken, especially when some have to be taken in the morning on an empty stomach. Others need to be taken in the evening with food. Others are 30 minutes before bedtime. Others may be at lunchtime. And so all of those things get to be very confusing, and packaging maybe doesn't help, because we know that the typical pill bottles that medications are dispensed in, while well-meaning, because the idea is to keep, for instance, small children out of those medications, it can make it really complicated for other people to open the bottle who actually need to do that. And then finally, there are some things that are more our fault. So something that's poorly communicated, maybe we don't provide the best education, either on the prescribing side, which is more where I work, where I'm maybe sending prescriptions to the pharmacy and not explaining well enough to the person taking the medication how I intend for them to use it. Or maybe it's on Catherine's side at the pharmacy when they pick up the medication. And then just, something that our healthcare system doesn't always do a great job of is following up to make sure that there aren't questions or there isn't some confusion that we can clear up. So in any case, I wanted to start off by recognizing that there are a lot of things that go into this. And a lot of what we're going to talk about kind of gets at some of those things related to maybe forgetfulness, or I know a lot of you, I understand from this group, are maybe caregivers and are trying to come up with a way to help your loved one who you care for manage their medications in a way that won't drive you completely bananas. So here are some thoughts. And the first is related to pill bottle management. So I'll kick us off, and then I'm actually going to throw it over to Catherine. These are a low-tech thing. So both of these things are available on Amazon. They're not great, as you can imagine, for people who take many different medications, because you have to put one of these little gizmos on each individual bottle. But if you've got someone who just needs help remembering whether they took a dose of their thyroid medication, and that's one of only maybe a few medications that they take, one of these things can be kind of neat. So the first one that you see there with the letter A next to it is called the Pill Popper. You can get 3 of those for less than $10 on Amazon. And they're just little kind of like rubbery push buttons on there where you can track whether you took it on Monday, Tuesday, Wednesday, and so on. And then the little slider tabs for letter B really work the same way, but that it has a little strip of adhesive that you peel off that actually sticks on the bottle. And you can get 5 of those for $20 on Amazon and just slide the little tabs over when the person has taken it. So that's one potential idea. And then Catherine, do you want to talk about this time cap?
Yeah, absolutely. So this is an interesting device that you can put on top of your existing medication bottle. So you just take off the bottle the lid that comes on the bottle from the pharmacy and add this cap onto it. And there's a couple different versions of this available, but this is just one of the brands of it. So they're $45 a piece online, so kind of pricey, but it'll show you, as you can see on the right there, the date that it was last opened, the day of the week, and the time. So if someone's to take a medication, say their blood thinner at 5 o'clock every single night, that will remind them to take their medicine. It'll display 5 o'clock, and then if it's not opened, then an alarm will go off after a set duration of time if that dose has been missed. So that's a really cool device that you can add, and it doesn't have any sort of communication to anyone else other than the alarm, like say ringing your phone or connection to an app or anything like that, but a pretty higher tech way to keep management of medications in a bottle. So if we kind of think about medication management in a tiered system, we would say kind of the keeping medications in their bottles is going to be the lowest tier. And then kind of a tier up from that is going to be different types of packaging available. So different packaging systems. So the first kind of low tech packaging system available is something you all more than likely seen is going to be pill boxes. They're easily accessible. You can get them online, pretty much any pharmacy or drugstore. And they're very easy to use. There's also kind of different administration times or different dosing times available. So you can get pill boxes that have once daily medications, twice daily. I've seen them up to 4 times a day. So pretty easy there to use. Labels with the day of the week as well as the time that you're to take them. However, one downfall to using pill boxes is that it requires someone to add those medications into the pill boxes individually. So that requires someone with a little bit of skill to know, is this a morning med? Is this an evening med? And with a pill box, you can only fill 1 week at a time unless you have multiple pill boxes that you're filling all together. Kind of a step up from the pill box is going to be pill packs or bubble cards. And this is something that we offer at our pharmacy here. So I'm a lot more familiar with this type of system versus some other ones. But we affectionately refer to this as a disposable pill box. So as you can kind of see over there, looks like a pill box, but kind of turned to the side. So there's 7 columns for the 7 days of the week, and then 7 rows, I'm sorry, and then the 4 columns for the 4 different administration times. So morning, noon, or evening-ish, and then bedtime. And it allows for all of those medications to be quote unquote mixed together there. So all of your morning meds are together, evening, so on and so forth. And you can even add over-the-counter medications in there too. So it's not like they're taking their medications from their pill boxes and also taking the supplements. Those can be mixed in there as well. So on the right or the left side of the card, where it looks like a blank piece of paper, that's where the pharmacy would actually put all of the medications that are inside that pack and where they are falling in all of those. So it's pretty easy to view which medications they're taking. So you can take that to the doctor's office, or if they're, admitted to, a emergency room or something like that, you can easily see what medications they're taking on a daily basis. On the flip side of that, if the doctor has discontinued a medication, you can also say, oh, they've discontinued the aspirin. That's the little yellow tablet that's in the morning spot. Then you can, have them take that out each morning, or even just send the packs back to your pharmacy and they can take that out for you and send those packs back out without that medication. So easy to identify there as well. Another great plus for these is it's easy to see if there is a missed dose. So visually, if they miss, the 3rd day, all of those medications, it's easy to see, okay, they didn't take Tuesday's dose of medications, what happened there, and kind of keep track of their adherence there. Another type of packaging system is the pouch packaging. So this is another common form that you can see. Lots of online pharmacies use this type of packaging system, but inside that box is a big roll of these little pockets of medication that you just kind of pull off and tear, and it has their name, their date of birth, and the date, as well as the day of the week and the time at which they're to take those medications. So it's a little blurry here in this photo, but you can see this is their breakfast medications that they're to take, and it lists each medication there. This is super easy to take and travel with. You can just tear off, say you go to work every day, you can just tear off your lunchtime dose and bring that with you in your bag and take those with you. Don't have to carry an individual little pill box with you with those afternoon medications. Pharmacies can also include the over-the-counter medications as well. up to 4 dosing intervals, so similar to those pill packs that I showed you. And it's also easy to track missed doses because it has the day of the week and the date on there as well. So they can see, okay, they missed Tuesday's dose again, wonder what happened there. So this is another cool option. Before I forget, the pill packs and these pouch packagings, these are going to be only available at a pharmacy. So you can't do these at home, unfortunately, but definitely check with your local pharmacy and see if that's an option for you.
I believe that this pouch packaging is the way Amazon is doing their medications, correct?
Yes, yes.
And is that something that people opt into, or is that just a standard way that they dispense?
That's an opt-in program for Amazon.
Okay. Do you know if it costs extra?
I don't know if there's an additional cost, but I can look into that.
Okay, just curious.
Yeah.
I've seen those and it is kind of cool,
Mhm.
the way that that works. Although I like on the bubble packaging, as Catherine was talking about, someone then has, usually it's in fairly large print that's fairly easy to read on, the one side, the list of medications with a little picture of what the pill looks like, I think is really useful. And then before we go into sort of these smart pill dispensers that get a little bit more high tech, this is kind of bridging the two realms. So it's a pill box, but it's a fancy one that has a little bit more of that like electronic functionality to it. And this one that I found is called the Med Center system, and it's $75 on Amazon. So definitely more expensive than just a pill box that you would pick up at the pharmacy. But it holds a month's worth of medications. So each of these little towers that you see is its own individual pill box, each with 4 compartments in it. So if it's the 15th day of the month, as it is today, correct? Yes, 15th day of the month, you would pull out the number 15, and then you have your 4 compartments with your morning, noon, evening, and bedtime medications, for instance. And then what you see down on the bottom row is a talking reminder clock that you can set up to 4 alarms per day to remind someone to go, okay, pick up that number 15. And it's got the date right there on it in case they forget what day it is. And there's a little voice that will remind that person, hey, it's time to take your evening medications. All right. So similarly, as we get into these smart pill dispensers, there are a couple that look kind of similar to this, where there are 28 compartments, and this thing sort of rotates and automatically opens one compartment at a set time. This one is $70 on Amazon, and it does flash at you and also has an alarm. And then the tipping motion that happens when somebody picks up the machine to kind of tilt the medication that's being dispensed into the palm of their hand will trigger stopping that alarm. But it will flash an alarm for 30 minutes once it starts in case somebody's outside and waiting to come inside. Now, with the 28 compartments, keep in mind that if a person is taking medication 4 times a day, then 28 divided by 4, they're going to be able to get 7 days worth of medication in this. If they take everything in the morning, then you can actually fit 4 weeks worth of medication in this. So there are these little dosing rings that it comes with multiple ones so that depending on the number of administration times per day, you can customize that a little bit. And then as you can tell by the price, this one is a little bit of a step up from that. This is the ePill MedSmart Voice. So not only does it flash at you and sound this alarm, there is actually a quote unquote friendly voice. I have not heard it myself, but the marketing materials say that it's friendly. And there is this voice that alerts someone that it's time to take their medication. Again, the 28 compartments. Another thing that's nice about this one is that it does actually lock with a key. So for a caregiver that's filling this, it'll keep the medications secure in there. And just one example of a time that might be useful is maybe you've got like a heavy duty pain medication in there that you don't necessarily want your loved one to be able to access all at once. There are lots of examples of times that might be a good safety feature. So it does lock with a key, and you can do up to 6 daily alarms on this one for someone who's needing to take medications that frequently. So I will also mention that there is also for $290, sort of a deluxe upgraded version of this one that has Bluetooth capability. Although I have a hard time seeing the utility of that, because the way Bluetooth works, you have to be within 33 feet of the unit. So it's not like you can use it to sound an alarm for your loved one who lives down the street or in a different part of the state, for instance. It's really only good if you want to keep from having to get up off the couch to silence the alarm. And then a couple of others that are semi-popular, MedMinder, which can be purchased at medminder.com. This one's kind of interesting because it's actually a subscription. So $50 a month, so not super cheap. It does also have auditory and visual alarms. So when it's time for someone to take a particular medication, you can see it's laid out similarly to the pill box that Catherine showed earlier, where there are the days of the week across the top, and then each of the up to 4 administration times going downward. And those little compartments stay locked, and the one compartment that corresponds with the time that you're to take that those medications will light up and actually unlock individually, so that you can take out that little cup and take those particular medications. The way MedMinder works, and they've added this screen that you can look at the weather and have pictures of grandkids on, but it actually will, if there's an alarm going off and a certain amount of time passes where the person does not respond by taking the medication, then you can have a phone number set up where it will actually call the phone of the person who's supposed to be taking the medication. And then you can also set up an extra safeguard where if they try that and aren't able to reach the person, then it will actually call a separate caregiver as well to check on that person. Another thing to mention about MedMinder, and I don't personally know anyone who has used this service, but one thing that they advertise as being available is that there is actually a MedMinder pharmacy that will deliver pre-filled medication trays. So if you look at this picture, there's actually another piece that lifts up from the bottom there, and that's where you lay in these trays of medication, and then you just lock it back down again. And their website says there's no extra cost to use the MedMinder pharmacy. So it's a mail order pharmacy. They send it to the home, these medication trays that come filled and ready to go, and you just click it in. And then it gets extra fancy because it will generate like a weekly adherence report that a caregiver can review, for instance. So that's one way to kind of make it fully remote if, for instance, you're caring for someone who does not live with you. And Catherine, do you want to talk about the Hero?
Sure. So this is an interesting device that you can have just like sitting on the counter, your kitchen counter, and it will dispense the medications from the boxy part up top into the little cup in the bottom. And you can add your own medications in there, or you can use their subscription and get the prescriptions through them. But it can manage, like it says over there, up to 10 medications, and you can control it from your phone app. It's pretty pricey to use, but is another option if you want to involve a little bit more technology in terms of the device.
All right. And then completely outside the realm of packaging, there are also different apps that are available on smartphones that can be useful. And all of these that I'm going to talk about are free. there are more than just these three, I'm sure. But My Meds, MediSafe Medication Management, and Mango Health. And really, they all kind of have the same overlapping functionality with some other bells and whistles on the side. So that whole idea with these is that you can schedule reminders so that your phone is reminding you or your loved one to take their medication. Alerts that a medication supply may be running low so that you can order a refill from the pharmacy. And then it also generates these adherence reports and some other types of data similar to what I talked about with the MedMinder that can be shared with family members or with your healthcare team. So they'll notify you by text message, by email, or by just push notifications on your phone. So just to give you some sense about what each of these looks like, the My Meds app has a pretty simple user interface. And there are these med coaches that are available. You can see in the image on the right, it looks like a text messaging window where you can actually do a live chat with a med coach. Now, I don't know what a med coach is, and I don't know how useful or unuseful that might be. So that's probably not incredibly helpful information, but nevertheless, that is something that is advertised with this My Meds app. The MediSafe app looks pretty similar. I know that may be a little bit difficult to see, but basically you can do this for yourself or for someone else where you input each of the medications that that person takes and then can go in and actually create a medication list that's useful for the person by linking it with a particular indication. So for instance, this is lisinopril. You take 20 milligrams every evening and you take it for blood pressure, so that is kind of all in one place for somebody to be able to reference. And then you set up a schedule so that, again, there can be reminders. What it looks like from the picture on the far right is that you can actually use this app to track some other personal information as well, such as your blood pressure, to kind of keep that all in one place. And then the Mango Health app, I don't have a whole lot to add there. It works pretty similarly to the other apps. But again, you can track information about blood sugar for somebody who has diabetes, set reminders to drink water for somebody who's dehydrated, check weight maybe for somebody who has swelling and needs to monitor that. So some other reminders besides just taking medication.
And what's cool about a lot of these apps is that your pharmacy may have an app that offers these services. So local pharmacies typically have apps, chain pharmacies I know all have apps. And not only can you order your refills from these applications, but you can also, again, track the taking of the medication and see when you're due for refill. So definitely check into that. It's worth a download to even just see what medications may be due for refill, and then also tracking the medication taking habits.
Kevin, while you're talking about pharmacy services, I did see there was a question in the chat about whether pharmacies typically will charge for the bubble packaging.
Yeah, so I did see that Amazon, their pill packing program, there's no cost added to get your medications filled through Amazon, and then in that pill pack kind of strip packaging. But typically your local pharmacy is going to charge for the adherence packaging. I know of a pharmacy out in Charlotte that does those strip packaging or the roll pouch packages, and they charge between $5 and $10 a month. And then we, not trying to sell our service here, but just from my experience, our pill packs that we do, that's $5 a month, and you'll get 4 weeks worth of medications, just covering the cost of the materials.
Yeah, thanks for speaking to that.
Yeah.
All right, and then take it away, Catherine. There are other things to do too, right?
Yeah, absolutely. So these are just some kind of low tech options that you can do, but even just setting an alarm on your phone to remember to take medications, or just have something, if they even have an alarm clock that's even more low tech than a smartphone. I think the biggest thing is just incorporating medication taking into daily routine. I had a patient one time who could never remember to use her insulin at bedtime because she had a very irregular bedtime schedule, but she did watch Days of Our Lives every day at 10 or 11 or whenever that comes on. And so as soon as she heard that theme song, that was her kind of cue to remember to inject her insulin for the day. So if there's, a morning cup of coffee that always happens, or what have you, incorporating that medication taking into that, if as long as that routine's already set, it's going to be a lot easier to add that one extra habit in each day. Another great thing that really enforces adherence is home delivery. So whether it be a mail order pharmacy or your local pharmacy that does that delivery, again, that's one less trip for you to make, one less trip for your loved one to make to the pharmacy to pick those prescriptions up. They just arrive to your door when they're due. So that's great. A wonderful program that pharmacies offer is called medication synchronization. I feel like the last couple years here, there's been a big push for this, but ultimately what it is lining up every single prescription to be filled at the same time each month or every 3 months, whatever the refill schedule is there. And that really helps you kind of keep on track of when everything is due, since the pharmacy's just having everything due at the same time. So if you're seeing one medication is not being refilled as frequently as all the other ones, then maybe it's not being taken as frequently or not being taken as prescribed. It also just helps with not running to the pharmacy once a week to pick up one medication here and one medication there, or even just having the deliveries, one here and one there. It even helps if you're filling pill boxes. You've got everything all at once to fill those pill boxes for the week or for the month there too. So definitely, last bullet point there, see what your pharmacy can do to help you. More than likely, the pharmacy you use has a medication synchronization program, or MedSync, as we affectionately refer to that as, program that can help you keep medications on track and keep those refills. They'll call you about a week or so before everything's due. See if you're still taking it. This is a great program if you have frequent medication changes, if they are changing in between blood thinner doses, or, those diuretic or water pill doses frequently, discontinuing medications, making sure that you're staying on track and getting everything, accurately that you're supposed to be getting. So definitely call your pharmacy. We're all here to help, and make sure that your loved one can stay as safe and healthy as possible. Again, I know we're here to talk about technology, but just picking up the phone and giving us a dial is going to be as helpful as possible. So that's all I have on that.
All right. So that's those are a few examples. Now, as Rebecca said, AARP does not officially endorse any of these products. Catherine and I can't even officially endorse very many of these products, but we just wanted to give you an example of some things that are available out there. And with that, we want to turn it over to you all to have any questions.
Absolutely. You caught the one question about the charges to package the medications, and just some things that bubble up. I believe many, if not most, of the bigger chain pharmacies offer packaging services. Is that, you think so? Okay. Yeah. Well,
They'll have a packaging service of some type.
yeah.
Yeah.
Well, and this is coming from a nurse. What are your thoughts on mail order pharmacies and medication adherence and technologies? What are your thoughts on those?
Personally, I think mail order pharmacies serve a purpose, in terms of that home delivery. I do work for a local pharmacy, so I do feel more strongly with, knowing your pharmacist, knowing, that your medications are going to be there in a timely manner, that they can be filled 15 minutes after the prescription sent to your pharmacy versus waiting 7 to 10 business days for it to be mailed out. And I will kind of plug if you're going to use some type of adherence packaging, a mail order pharmacy, if there's, a transition of care there, whether it's from the hospital to a facility to home, hospital to home, and there's medication changes, your local pharmacy would be able to do those within 24 hours, whereas a mail order pharmacy would take, quite some time to ship those packs back, then repackage those and mail them back. So if there is, a frequent, transition of care there, then I would definitely, steer more towards somewhere where you can have those changes made more frequently. However, if you or your loved one is very stable, there are no changes really except once a year, then by all means, a mail order pharmacy is really going to provide a good service for you if you're just getting those fills every 90 days.
Great. Thank you, Catherine.
And I would add to that too, just being a little bit more on the prescribing side, that one thing about the adherence packaging is that it's so wonderful. Once somebody is on sort of a stable medication regimen, it becomes a little bit of a pain in the neck for people in whom we're constantly making tweaks to doses or trying a medication that may not work, and then we have to go to a different one, because it just can add a layer of confusion for somebody who already has that medication packed into those bubble packs. With that being said, sometimes we do need to make changes to a medication regimen for someone who already has, 4 weeks worth of medications filled. And for me, it's much easier to call Catherine over at Sona or somebody here locally and say, hey, we're going to actually stop that medication, and kind of speak to somebody in real time who I know can help me take care of the issue. Whereas sometimes it feels like, I don't know, for those of you who have filled at a mail order pharmacy, I don't know how easy it is for you to get a live human on the phone, but even for us who are working on the provider side, it can be difficult to find someone who can help in that sense.
Great. Thank you. For those of you who are on mute, who has questions for these two amazing gifted pharmacists?
I want to ask a question, and I'm just assuming, because people might go, oh, and they see some of those prices, some of the actual physical pill plastic boxes that have the e-alerts and all, $45 and up. But I assume like HSA and FSA health spending accounts, flexible spending accounts can be used for those. And can I assume also that if you're buying that for your care receiver, you can get those on use your own account to buy those kind of things for them? Is that true?
I honestly don't know. I don't know if you can use like an FSA or HSA card. I know a lot of the ones that were found were from Amazon, and I don't know if Amazon takes those cards. But I know like just traditional pill boxes, you're able to use those, or you're able to use that flexible spending account on those. That's an interesting question though. I never thought about that.
I sort of assume so, because I know the one I have is a Visa card, so I don't think that Amazon would pay attention to what kind of account it was. I just sort of wanted to bring it up because a lot of people forget about the ways they can pay for these things.
That's a great question, and I, like you, would have a similar assumption that you could use an FSA as easily on Amazon as you could a debit card. I do see that Amazon has frequently asked questions that says, yes, you can add your FSA or HSA card as a payment option in your account. So confirmed.
Fabulous.
And then one other question, way back to the very low tech thing, which was that little pill popper attachment. I thought that was sort of cool. Do those unpop? Do you know? So if you pop in Monday or Tuesday the next week, can you unpop them and reuse them, or do you throw it in the trash after a week?
Yeah, you can unpop them and reuse it. I think that transition in the week would be where you could run into some errors is, Sunday rolls back around and now you're trying to remember. But yes, they're reusable from week to week.
Yeah, but they're $3.25 each.
Right.
And I've run into patients and families who like having that as kind of a thing to do. It's just something they do besides just taking the pill. So almost like a game to help with it.
It's like making a to-do list. It makes you feel productive to cross it off.
Mm-hmm. Great questions. What other questions do you all have for very experienced pharmacists here? And we've been so fortunate to have someone like Tasha from the provider side and Catherine from the pharmacy side. It's just been fabulous. It really works. Thank you, Anne. Any recommendations for people who have difficulty opening up medication bottles or those with hand tremors? Great question.
Absolutely. So you can actually elect to have the easy open caps added to your bottle. So that would be a call to make to your pharmacy, and they would be able to document that you have signed off on that, and then you can get those easy caps.
I was thinking it always seems like it's the younger generation taking care of the older generation. But in some cases, this is an opportunity for maybe teenagers to help in some kind of care of grandparents or something, just because some of these new ideas would be perfect because they would understand the technology so well. So it might be a way to incorporate more generations into some family care and give them some responsibility.
Yeah, I
Fabulous.
love that idea. And if you're using something other than pill bottles as your sort of medication management system, I'll just mention even those pill boxes can be kind of difficult to open for some folks. So they do make ones that work the same way, but have, for instance, like a push button that pops open the little door so that you're not kind of prying it open. Different options like that.
And some of the devices that I've seen in my practice, those with the alarms, when they pop alarm, the cup that where the medication is slides open. The challenge is just for the person to have some sort of dexterity to scoop it out. So depending upon the person's dexterity and tremor status, sometimes it's very doable. Sometimes with a big spoon to scoop it out. But if not, then there are other challenges. But that's a great question, Anne.
Or Sheila's pixie stick.
Pixie stick, yeah, pick them out. Sheila O'Brien, who was on our session in the fall. You all may know her locally here in Asheville. Occupational therapy, great. What other thoughts or questions do you all have? While some of you are thinking, I'll share with you that one of my clients has one of those fancy schmancy medication dispensers, and it alarms every day at 9:15. Now, she is living alone with cognitive impairment. This is what's helping her to live independently a little while longer. Oh, I get many calls about that there's no more medicine in there. I'm not, it's empty, which she's confused because the cup is empty, but she's taking those. We've seen her medication adherence go to very nearly 100% by having something. She hears the alarm every day at 9:15. She goes and takes her medications. They work. And some of them are linked, as Tasha and Catherine said, to families. They're notified if things aren't done. They get phone calls. These things really do work to keep, if that's a goal, right, for Tasha and Catherine, to keep people at home independently longer and to help caregivers have some sanity. It works.
And just if something happens, it makes sure that someone else is really familiar with what their loved one is taking by just having some of these gizmos or having just the electronic list or the membership thing. You really know exactly what's going on with their meds.
That's exactly right. Great point. Well, I want to thank Tasha and Catherine for joining us. I mean, as someone in the community who works with these two amazing professionals, it's just great to hear them share their knowledge and experience with you and just give you some more ideas of ways that you can harness technology as a caregiver or a care receiver to help with medication adherence. Tasha and Catherine, thank you so much. Thank you all very much. Bravo, bravo, absolutely. And wherever you are in whatever communities in which you live, talk to your pharmacists. They really are a wealth of information, all of them. They really are. I just wanted to let you know that remind you that once again, that we are going to be having a survey that will be emailed to you. Please provide feedback to us, good, bad, or otherwise. We want to welcome it all. It's good for us. Thank you, Rebecca. She's dropped the survey link in the chat as well. And I also want you to know that we have another session, a special session coming up on March the 8th at 2:30 on advanced care planning. It's so important just to use, and we're going to be sharing, the speakers will be sharing tech tools, personal conversations, and some of the requirements to make sure you complete or your loved ones complete the proper advanced care plans. And Rebecca's also put that link in the chat. So please feel free to join us and share with others. And because this is recorded, please go out to the AARP of the Mountain Area of Western North Carolina's YouTube site. You'll see this video there. So thank you all very much. And we look forward to seeing some of you next month. And thanks once again to our speakers. We appreciate it immensely. Take care, everyone.